In early 2020, COVID-19 cases arrived in the U.S. 3 years ago this week, a state of emergency was declared in Oklahoma, with the state reporting its first COVID-related death on March 19th. Well, a lot has changed since then. We're talking 3 years later now. Joining us now live with a look back and an update on where we stand now, OU Health's Chief COVID Officer, Dr. Dale Bratzler. Dr. Bratzler, good morning and thanks for joining us.
Yeah, good morning.
So let's kind of take a step back. 3 years. Give us a quick refresher. Take us back to 2020 and how this all started.
Yeah, so we first learned that there was this pneumonia disease that was going around in China in late 2019. They first notified the World Health Organization right at the end of 2019, and many teams started meeting here in the U.S., including ours at the university, in the first month of 2020. We knew it was going to get here. We'd seen it before with other viral infections, and we're waiting for the worst. And indeed, it was around March 7th that we saw the first case in Oklahoma. We now know that cases had been in the U.S. probably prior to 2020, and certainly much earlier in China, and it quickly spread from there. We've had multiple waves. The three that were most notable was the original wave of infections that we saw in 2020 when we did not have any vaccines. We then subsequently in 2021 saw the large Delta wave that happened in the summer, quite surprisingly. It really hit us hard in the summer. And Delta was notable because it caused quite a few deaths in young people. And then December, January 2021, 2022, we had this huge wave of Omicron when we had at times 2,000 Oklahomans a day in the hospital.
Yeah, and so a lot of things have changed. I mean, I think we can all remember back to when this all started happening. It almost felt like chaos and everything just happened so quickly. Talk about the response to treating this pandemic when it first started and when we first started seeing a rise in cases to where we are now.
Well, I think early on we didn't know. We had no vaccines to prevent infection. We did have some interventions like wearing masks, personal protective equipment, wearing gloves, certainly to prevent the spread of disease. We at the university, as many colleges all over the country, ended up going virtual for a period of time because we didn't have other good ways to stop the spread of this disease. This particular disease spreads easily from person to person. You breathe the virus that comes out of somebody else's mouth. And so we knew that when you brought people together in close quarters, you were likely to see people get infected. We had no treatments, no vaccine. So that's how we started this off, was with some things that maybe we regret at some point, but closing down schools, stopping people from coming together.
So now here we are 3 years later and things are so much better, but there are still a lot of unknowns, like, for example, long COVID, those lingering symptoms, and a lot of people who still can't taste or can't smell after getting COVID 2-3 years ago. Give us an update on that and the research that's still being done with this virus.
Yeah, so there's a lot of ongoing research at this time about the mechanisms that cause long COVID syndrome. We know it's real. Many patients run into physicians or other healthcare providers that may not recognize it or understand it, but people who come in with chronic symptoms who had particularly more severe cases of COVID are quite common. Most of the studies now are suggesting that up to 10% or more of the people who had COVID will get the long COVID symptoms. You talked about loss of taste, but the most common symptoms that tend to last for longer periods of time are fatigue, weakness, difficulty sleeping, people having headaches, and then joint pain, some autoimmune syndromes. There are a few people that have developed diabetes after getting COVID. So we're still learning about what are the mechanisms by which long COVID occurs.
So in the U.S., the CDC has reported more than 100 million cases and more than 1 million deaths. What does Oklahoma look like right now?
Yeah, so Oklahoma, I think within the next couple of weeks, we will go over 1.3 million cases in our state. We're almost 18,000 Oklahomans that have lost their life from this particular disease. And whether we like it or not, we're going to continue to see people die of COVID-19. I'm particularly worried about the elderly. Earlier in the pandemic, we saw more younger people getting sicker and having other complications. But now the virus is more infectious. It spreads easier, but it's not as virulent, except for the elderly. The elderly in particular get hit particularly hard with the complications of this disease. 90% of the deaths now are in people who are 65 years of age and older. So I think all of us have a responsibility to help prevent the spread of this disease to the elderly.
Looking ahead here, as a health professional, as a health expert, and what do you see that we can do better? What have we learned in case another pandemic like this were to ever happen again?
Well, some things were structural. So, as I mentioned, I'm in a meeting of colleges of public health, and we recognize that the messaging, the amount of misinformation that came out was surprising to all of us because we've been in this business of promoting vaccines to prevent diseases. You know, we eliminated smallpox. We had almost eliminated polio before we kind of took our foot off the gas. The misinformation that came out around the disease, the virus, the vaccines, and others, I think that surprised us. So I think it's incumbent upon all of us to make sure that we're spreading information that is correct, that's science-based, and more science is going on. The second thing that happened was public health across the country. Now I'm talking about health departments and others were simply underfunded and understaffed. That came out very, very quickly. There's an enormous push to improve the staffing of public health agencies so that they're ready to respond to these types of events. And then I want to make sure that people recognize that the U.S. healthcare system is still really struggling post-COVID. So we lost so many people who left the profession, things like nursing and others, because of the stress of dealing with COVID patients. People who were not on the front lines of taking care of COVID patients simply don't understand how stressful it was to nurses, doctors, and others taking care of people who were so sick, for which we had very little we could do, and we saw so many people die without their families at the bedside. It was incredibly stressful for healthcare workers. So many left the workforce. At the same time, that healthcare systems had to go out and hire contract labor to cover, to just do basic necessity of taking care of patients. Supply costs went up. Healthcare systems are really still struggling post-COVID.
Well, we definitely appreciate and are thankful for all of our healthcare providers. Dr. Bratzler, thank you so much for coming on and speaking with us. We appreciate your time.